My expertise is really as a nurse. I've worked with men for about 20 years who've had prostate cancer. Movember have spent a lot of money in developing up projects to help men after they've survived their prostate cancer, and they're in multiple countries. So they're in the USA, Australia, Canada, New Zealand, and now they're looking at Singapore and Hong Kong, and they're working with men and their families as well as practitioners and scientists. And what their view is that it should be fun doing good. So the whole idea is that this is about trying to get lifestyle into mainstream healthcare, and that considering sort of the exercise and diet as strongly as you would say, having radiotherapy or surgery, that it's actually part of your treatment, that it isn't something that's an added extra. This is something that everyone should be advised to do. So Movember have put a lot of effort into the work here, and we're working globally as a group to try and share expertise and knowledge and build a sort of global picture that we can begin to help men right across the world. Well, treatments are very effective. At the moment, we have about 40,000 men in this country diagnosed per year, and that is almost the same number as women with breast cancer. It's a very prevalent disease, but what we see is that about 250,000 men now survive, and you're looking at 10 years at least 84% survival. So it's a disease that is now not an acute illness, it's a chronic illness. It's something that you get when you're older, but also it's something that most probably you'll die of something else, not necessarily the prostate cancer. The hormone therapy improves survival by 40%. That is substantive. Before we had hormone therapy and the use of it as a sort of with other treatments, it was about 60% in this country. We're now moving up to 80% survival, which means that most people are going to have at least 10 years plus with the prostate cancer. And this is why exercise and lifestyle changes are becoming important, because previously people didn't survive. This wasn't even on the agenda. Whereas now, what we're trying to do is say, survive well, survive fit, and enjoy that time by just making some small changes. My worry in terms of the men who've completed is that often they're older men. They often, the average age is about 65, and although there's a wide range of men who have prostate cancer, the issue is that you can be cured of your prostate cancer and then have other problems that as a result of your treatment or a consequence of the sort of risk factors that the treatment causes. And what I mean by that is that men with prostate cancer, we know, are more likely to die of things like diabetes, heart disease, and so it's often to do with the therapies that they have that push them over in terms of the other diseases. And I think men are particularly bad at seeking help and being sort of proactive at managing their health. I think as a woman, we're more likely to go to the doctors, we're more used to talking about health, whereas men don't tend to talk about health. And prostate cancer being a cancer of, sort of urinary systems, around your genital area. It's not the sort of thing that you just talk about in the pub. It's very private. And so a lot of the men don't sort of share their experiences. They might have symptoms, might have problems, but don't necessarily do something about it. So my sort of worry is that we focus on the treatment, we cure all these people, and then leave them almost scarred with problems that actually affect their quality of life, their sort of healthy aging. This study is really focusing on trying to improve heart health and risks for men with prostate cancer, not necessarily curing the prostate cancer itself. And so this study is about improving that health longer term. It's important because men with prostate cancer who have hormone therapy are more likely to have cardiovascular risk factors. It's often those men who are not perhaps so fit, those men who have combination therapies, who are likely to have hormone therapy. And what it does is it basically drops down some of their male hormones, their testosterone. And although it's really, really good at sorting out the cancer, improves cure massively, what it does do is actually change the way they metabolise fats, and that can then increase their risks for heart health and diabetes. And although it sort of, you can't see it, it's inside you, it's invisible, and the effects aren't straight away, in the sense that the man's not going to know necessarily that these inside changes are occurring. It does affect things like where the fat's distributed on the body, men lose muscle. And that then affects things like your physical health, how active you can be, but also gives you more weight in terms of, obesity, those problems. And then that subsequently causes risk factors. It occurs quite quickly with men who've had hormone therapy, and the testosterone drops within 3 weeks. So what that means is that the profile for the fats change, and the men find that their stomachs get bigger. And we talk about it as the sort of the tyre of prostate cancer, and it's very quickly you develop this sort of what I would call a muffin roll, this little tummy here, and then you begin to lose muscle mass as well. So things like the legs become thinner, your strength is not so good, and also people feel very fatigued. So the men talk about feeling tired, they can't do the things they did, that they would normally be able to walk sort of to the shops, but find actually walking back now difficult, can't climb stairs, those sorts of things. And it's subtle, but what happens is that the less you do, the less you're actually repairing that damage, and over time it continues to deteriorate. Most people think that they're pretty healthy. If you can do everything that you normally do, and you can walk down the shops, and you feel you're unhealthy when you're really struggling to climb stairs, and that sort of thing. But it creeps up on you subtly over years, and then suddenly you look at yourself and you've gone up 2 trouser sizes, and you're suddenly thinking, actually I've got a bit of a podge. But most people have. In this country there's a large proportion of people who are obese. It's not unusual. The difficulty is trying to say to people, actually the combination of these factors plus having prostate cancer just increases those risks a little bit more, and it's inside you can't see it. A lot of men of that age have multiple illnesses, so they'll have diabetes, heart disease, they might have blood pressure problems, and often I think it's every decade you get another illness, so by the time you're about 80 you've got about 5 or 6 different diseases, and that's normal. But you'll have a different doctor, different hospital, different people managing it as a specialist group, which is great, but none of them talk to each other. So a lot of the men I've talked to, when I've asked them about, were you told anything about, you're on hormone therapy, has anyone said to you about you might need to have your diabetes checked more, or you might need to just get your heart risk checked? They go, well, I'm under the doctor for my heart. I'm now on annual review, or I'm seeing the diabetes nurse, but I only see her once a year, and she says everything's fine. And there isn't that sort of joined upness to think, okay, right, I've got prostate cancer. There is a link between heart disease and the changes that you get in your fats from the drugs and the hormone therapy that can impact on other diseases. And no one really talks about doing prevention yourself. So, when I talk to men about, okay, there's things you can do yourself to reduce your risks. The drugs are brilliant, they'll cure your cancer, you want to stay on them, they're really important. But try and reduce the other risks. You're overweight, your blood pressure's up, you're got risk factors in your cholesterol, dietary change can really make a difference to that. So it's sort of like, it's not just about sitting back and letting these things just happen. As a cancer specialist myself and a nurse, we don't look at people's heart health. You know, we look at cancer. We're like this, we're blinkered. We're focusing on curing the disease. We're looking at prostate cancer. And we don't look at things like diabetes measures and heart health. But what we've got to do is really look at things completely. And the men can then, once they know their numbers, look at, okay, what things can I change? Sometimes it's even really small things like losing a little bit of weight, not masses, half a stone, small amounts, increasing walking, increasing using steps, that sort of thing, just to improve that muscle mass, and increasing fitness. And even if men have not had hormone therapy, we know from big studies in the States that if a man with prostate cancer, even if they've had surgery, if they increase their physical activity, it improves their survival from their disease. We know that if you're overweight, if you have poor fat profiles in your body, then you're more likely to have prostate cancer. And we know that these men, from these big American studies, who do more activity, they lose weight, they are fitter, and so they're less likely to get their prostate cancer come back. And it improves survival overall. The importance of having a bespoke for sort of prescription, something that is very individualised, is that we're all really different. You can be thin and still have a lot of metabolic problems. And you really need an individualised plan. So for someone who's lost muscles, they need to have more dietary advice that improves their muscle health. So just the sort of healthy eating, you know, lose weight, you need to lose weight, is not really going to be make that difference for people. If it's individualised, you're going to have much more impact, and it's personalised. It's something really special. The rationale behind giving a prescription, a personal prescription, is that we're all different. There's lots of generic advice out there. You know, we all know we should do more, eat less, you know, eat healthy. I think it's, you know, most men I talk to, you say, look, you know, I've been given lots of different advice. You know, my wife tells me this, my son tells me that, the doctor tells me this. I really don't know what to do. So what the whole idea of this is to actually try and come up with some real sort of figures that you can actually say, yeah, this is your strength in your muscles. This is your fats, where it's distributed, what you can do. And having your own individual prescription gives a much more specific thing to do. You know, it's most men say, where do I start? You know, yeah, I'm fat. I know I'm fat. I know I'm unfit. Yeah, but I'm not going to go to the gym. I can't run 2 miles. I can't do star jumps. And, you know, I'm really not going to go weightlifting. And what we're saying is, actually, you most probably don't need to do that. You only need to make small changes on a personal prescription to make a difference. So we've worked with nutritionists, dietitians, we've worked with exercise specialists and sports specialists, as well as cancer specialists to look at cardiovascular disease. So it's been quite a team effort, I would say, definitely a team effort for pulling all of this together, to look at it as a complete package. Most of the things that we are told aren't necessarily based on evidence. It's often the sneaky things that we do that make us put on weight. So, you know, drinks, lattes, cafe stuff, snacks, when we eat, and all those sort of things. And, you know, just thinking about plate sizes increasing. You know, from the 50s to now, you know, we had little plates in the 50s. If you go to a junk shop, they're tiny plates, but actually that was the size of a dinner plate. Now they're huge. You go to a restaurant, you have this huge, great big plate. So there's lots of things that, okay, what is healthy eating? It's changing. It's hard to know exactly what we should do. So really, this is about trying to get the evidence right. This is about lifestyle change. This is not a diet or an exercise program. This is about small changes you make in your life that actually you'll keep, that will live with you. This is about changing what you do for really forever. Well, one of the things with exercise and diet and that is that you don't eat alone. There's nothing worse than being on a diet and someone coming down, sitting there in front of you eating a cream cake, or saying to you, come on, have another slice of cake, go on. And of course, you know, you feel obliged to, don't you? You just can't sit there and watch someone eat a piece of cake. So the key thing with having families and friends help you is to actually work with them and get them involved. You know, if you're cooking and eating differently, then partners can really help with cooking differently, buying different foods, not having some of those foods in the house that might be tempting, thinking about portion control, those sorts of things. But also with exercise, you know, it's sort of walking with you, helping with sort of if you're going out for a daily activity, you know, instead of going to the cinema, maybe a walk in the park, doing different things. So family and friends are really, really crucial. It's all about moral support and motivation and having someone that you can do it with, sometimes groups, clubs. Benefits from exercise are that you feel a lot better. You know, anyone who is feeling fit, you have that lovely feeling of that you can actually achieve things that you want to do. There's nothing worse than struggling and feeling fatigued and tired, and we know that exercise can improve that. If you can improve your fitness, it improves how you feel. It also can improve other symptoms. We know that men benefit from exercise by improving the tiredness. So although you may feel tired, if you do something about it in terms of exercise, you begin to feel less tired. It reduces symptoms like incontinence. If you lose weight, it improves your incontinence. So we know it affects other symptoms. So I see that the men would get benefits quite quickly from this programme. It's about self-belief, and the key thing with the psychology is the sort of coaching model. You know, it's like, it's very difficult to do this alone. You really need that sort of, you need to sort of set yourself realistic goals, but also see those benefits. If you set yourself something too hard to do, you don't begin to see those improvements. So it's the small things that you want to be able to do and see little changes and see those improvements. You can always do it now. And there's always tomorrow that you can improve. So it's about the psychology and understanding the psychology of why you might snack, why you might eat, and having that mental ability to say this is important. Now, you know, for a lot of the men, I gave them a tablet or something they had to do as part of their treatment, they'd do it every day. But to say to someone, look, this is going to be important for your health, people go, oh, it's difficult, it's hard, that sort of thing. But if this is treatment, shouldn't it be taken just as strongly as, say, taking a pill? You know, if you take one every day and you have to take, say, like do an exercise every day, that is the same rationale. So part of it's the psychology, it's that thought that this isn't about doing something that is completely radical. This is small changes that will make a substantive difference to how you feel and how men survive the cancer. And what I want is men to survive well, not just survive and have symptoms and feel grotty and worry about their prostate cancer, but to feel, yes, I'm doing something myself that's going to really make a difference. What you've got to do is set realistic goals. Think small. Think, okay, right, I'm going to be able to walk down the shops and instead of, you know, taking the big trolley, I'm going to carry a basket. Do small things that build muscle mass, get your strength up. Do it every day. Think about it all the time. And then reward yourself with, great, I've gone down a size, let's buy myself some new clothes. Let's go out and, you know, if I get to this weight, then I'm going to do something really special. And it's not a hair shirt. This is not about starving yourself or, running miles. These are small things, small changes, and it's about actually feeling good about yourself. Take control, that you can actually make a difference. Have that belief that, I don't know if my prostate cancer is going to come back. I don't know if I'm going to get recurrence. But hey, let's do something that possibly could make a difference, could improve my chances. And, I say to guys, stack the odds in your favour. This is about trying to improve the risk factors, but stack them for you, and only you can do that. A lot of healthcare is focused on hospitals. And actually cancer care is something that you have in a hospital, but majority of the care now is based in your GP or at home. And long term, you don't want to be going back to a hospital. If you go to a hospital, you have to pay parking, you have to wait, it's very busy. And the reality is that with this number of men, we're talking 250,000 men after prostate cancer, there is no way that our hospitals can manage to be providing long-term advice. This is about a long-term care package. So where could it be? Well, GPs do some of this, but naturally, pharmacies are the place where often men go, pick up drugs, pick up their prescriptions, might be buying pads, buying products, shaving foam it might be, or it might be something that they need. But we all live roughly within about 20 minutes of a pharmacy. You can park at a pharmacy. They are open in the evenings, they're open at weekends. So it gives a very accessible area that you can go. The other reason that we're working with pharmacists is that pharmacists are very well trained people. As a health professional, they do 4 years of training. They are very experienced and they do a lot around long-term management and illnesses. They know a lot about health and medications, and they are moving really for the future into managing chronic health. So this fits really well into the new remit of pharmacies.